Ready. So we're going to continue on with Essential Science, Chapter 11. And we had left off with the circulatory system. And we're heading on into the lymphatic system, but you're going to see that you really can't separate them. They're intrinsically connected. And so trying to divide it into too many unique parts becomes a little redundant. So this is Chapter 11, Essential Science. Let's share the screen. And here's our textbook. So we had just finished looking at the circulatory system. And so I want to get back up on that for a minute with a review here. So we looked at the heart. We looked at all the different parts of the heart. And we need to have an understanding of the cardiac function because it's important. It's part of homeostasis. We affect heart rate if we affect the autonomic nervous system. So then we get into the vessels here, right? And so this is where it gets, you have to understand that it isn't as clean cut as this. So the tubes that carry the blood, arterial, oxygenated, venous, on its way back to the heart and to the lungs to become oxygenated. The real exchange happens right here at the capillary level. And right in this arena is also where you get your lymphatics embedded. And I looked this morning to see if I could find some figures, some pictures that might give you a better idea of the extensive nature of this. So I think this is, nope, that's the Zoom meeting. I think, there we go. So this is off of Bing Images, and this is the torso and all of the distribution of the tinier vessels, and you can see some of the big ones in here too, but the tinier blood vessels. And you can extrapolate that right in with the lymphatics, that it is just as much of a vast network. Here's a closer view of this on the torso. So the question I have is, how can we massage the body, the soft tissue, without touching indirectly and putting mechanical load into all of these tubes? And when you press or pull on a tube filled with fluid, it's going to, at least at that very local level, have some sort of an influence. Here's a picture of the hand and the vascularity there. And again, you might as well just say, okay, not only is this the way that the circulatory vessels of the veins and the arteries, this is just the arteries. This doesn't even include the network of veins in through there, as well as the network of lymphatics in here. I mean, the body would have its entire form if this is what all that was represented. And you cannot separate the connective tissue. Those are all the anchoring and the scaffolding for these vessels to attach to keep them in place. Here's another picture of the dorsal side of the hand. This is vasculature of the head. And I think that's enough to give you an idea of what we're looking at here. So it's everywhere. All right, now let's look at this lymphatic structure. So this is from this website. I was trying to find a similar picture of the lymphatic network, and I couldn't. But I think you get the idea with the extent of the vascular tubes. So this is a pretty good schematic here of the relationship between the lymphatic tubes and the cardiovascular vessels. Then this is the capillary bed. This is right at a cellular level. And then how these tubules, these lymphangions, that I killed, lymphangions are, and they're open-ended right here. And then this is your tissue spaces and the fluid that is in there that's picked up, and then it is collected by the lymphatics. So there's a couple of other pictures here that so once these are collected, then it starts to weave through a variety of these lymphatic vessels with these nodal areas that act as filters and have variety of white blood cells and other immune type cellular structures. And another picture of this mesh, and that is everywhere, everywhere. So if we're going to influence the vascular system, then somehow or another we have to facilitate the movement of the blood through the tubes. And like mentioned before, the arteries are under pressure. They have the heart, plus they also have a contraction capacity right in the arteries themselves. And then this area right here, this kind of pink purple area, this is where the nutrients are actually exchanged with the tissues. The capillaries become 1 cell thick here, and oxygen can get out, and it picks up metabolic waste, and some of it goes right back in through the venous system. Some of it does not, though. And so all around these various cells is the interstitial space filled with interstitial fluid. And then these little open-ended lymph capillaries, they open up, and the pressure is less in there, and the fluid then just kind of goes in. And then once it's in the tube, then it uses the generalized movement of the tissues around it to push it through into the larger and larger tubes until it eventually gets in the trunk, and it's filtered with through various lymph nodes. And then it's the breathing and that is kind of acting to pump this fluid along. So here is a really up close diagram of that. And I want you to pay attention to these little filaments that are anchoring this little tiny vessel to connective tissue in the area. And it's not like this is an opening, like the end of a straw. But I've got a lawnmower going. So I'm going to close the window here briefly. Don't you love recorded live entertainment? There. Okay. So these are little flaps. And they, as the connective tissue that it's anchored to slips and slides, and it opens these little flaps up. So if we're going to mimic normal and we're trying to support the movement of fluid in the tissue space into these collectors, then what we can do is open the flap. And we do that by sliding the connective tissue points here back and forth. And then then the fluid will just flow in because the pressure is less in here and the pressure is more on the outside. So that's the foundation of part of what we're going to consider when we do a lymphatic. We target massage or we adapt massage to create a actual lymphatic support, and we mimic the normal. So once you understand this, then the methodology is easy, and the methodology is explained in chapter 12 in Fundamentals. The portion of this chapter, we'll go back to our chapter here, the portion of this chapter that relates specifically to either how we are trying to potentially support movement of fluid in the big tubes and support potentially exchange of fluid down here in these microscopic capillary beds. And secondarily, the lymphatic system. You've got to kind of visualize what's really happening under your hands, or the methods described in chapter 12 in Fundamentals won't make any sense. So this is a quick review. And so now here's a picture of a squeeze. And can you visualize all that network of capillaries there? And how it is getting squeezed. There we go. So massage, the mechanical loading, the mechanical force application is going to indirectly, the only thing we can touch directly is the skin, but it's going to indirectly have at least a local response, a local effect, or a local stimulus on this sponge, this spider web, this interconnected bundle of tubes that's everywhere. Okay, so So see, this just doesn't do it justice, these types of figures. They're great for understanding, but they don't really give you that look beneath the skin. Okay, so where we left off then is the lymphatic system, and an understanding of the anatomy and physiology of it, so that we can appreciate how it contributes to homeostasis, and how we may be able to support the normal function with massage therapy. So here's your section objective, here are your chapter objectives, and here are the ones that are covered for this particular section. So here's your general overview, and this is attempting to represent that lymphatic network that is quivering. It has its own little contract, relax, pulsation to it. And you combine that with that same kind of rhythm in all of those little vessels, then it's likely that when we have our hands on somebody and we feel something moving in there, that we're feeling this rhythmic pulsation and movement of the fluid around and through there. And that's a good biologically plausible explanation for that kind of undulation, that once you really are paying attention, almost you're very mindful of what you're feeling when you touch something. You can notice that, and the sensation is consistent what you would notice if you were studying hydraulics or fluid movement or movement in the tubes or whatever. So the nodal areas, the filtering stations, especially in the limb area, are where the joints are located, because that's part of this pumping action. And then places where we would have a lot of intrinsic squeezing anyway, a lot of pressure and let go, pressure and let go. There are like pumping stations there too for the lymphatics. And so that's the palm of the hands and the bottom of the feet. So if we're gonna mimic normal with the massage, then we're gonna wanna, so this gets moved every time we walk, lift, press, lift, press, lift, press. These are squished every time we move a joint. So the plexus in the hand is squished every time we grasp and let go. And the little anchoring filaments that we looked at in that one figure are being, on the areas that are a little more taut, that's where you're getting that little bit of pull, and that opens the flap, we think. So this is kind of an example of what we're looking at with that, and what we can touch is the skin and superficial fascia. And while there are lymphatic meshes everywhere, there is a lot of them are between the superficial fascia and the deep fascia. And so so they're anchored to the deep fascia that's like a big piece of saran wrap and at one end, and they're anchored above to the superficial fascia, which is more sponge-like. But when we slide this back and forth, there's a tug on it that is opening and closing those flaps. That's the natural way this stuff moves. So if we're not moving around, stretching, bending over, lifting, etc., this secondary pumping action of the superficial fascia sliding a little bit. It doesn't move very much. It's like little. That can interfere with the normal pickup of the interstitial fluid. So that's what we're doing with these little bitty movements, is we're making contact with the skin, and then we're taking it from its static position, its position where it's easy, moving it up to bind. And what we're hoping is that we are putting enough drag into that we can encourage those microscopic little flaps to open. You really got to think little. I really think little here to get some sort of a visual of what you're trying to do. And so there was a point where they didn't think that there was a lymphatic system structured specifically in the brain, but they have come to find that it's called the lymph system. It also functions very much like the generalized lymphatic system flow, and it's tied in with the craniosacral fluid system. And if you hold to that there is the teeniest little bit of movement of the skull bones, and when you're holding that and you feel that little pulsation in there, this is kind of the premise of craniosacral therapy. There's a lot of different forms of this, and they talk about this cranial rhythm, but the undulation, the natural undulation of this fluid movement inside this container, if it can move just the teeniest little bit, then maybe we're feeling that. This whole tissue, the soft tissue part of this, the scalp, has a lot of fluid moving around in it. So maybe that's what we're feeling. So, you know, we kind of don't know for sure. So this is getting into this idea of biologically plausible, and you can't stretch it too far, or you get into pseudoscience. So, okay. The lymph itself is what it is called once it gets into those lymph angions, those little microscopic capillaries. Before it gets in there, it is interstitial fluid. So we have the vessels, the nodes, and the organs. And the lymphatic system becomes an important part of the immune function. So that's the next piece of this. So you can't talk about the immune system without considering the lymphatic system, and you can't think about the lymphatic system without considering this, the cardiovascular system, and you know, so it's all woven together. So here's the schematic that's similar to the one that I showed you in the, when I did the web share on the cam here, to give you kind of an idea of what's going on here. So here are these little anchoring filaments, and the supposition is that on a macro level, this is all happening microscopically, but on a macro level, if we can create enough slip back and forth into tissue that has these anchoring filaments on it, we can help open and close these vessels. So another picture of the same kind of thing. Now, these lymphoidal organs there's a lot of stuff that happens in there. So I like to think of them as places where immune cells go to school to learn how to be immune cells. So there are a lot of these, and a big one is the spleen. And the spleen also acts as a reservoir for blood. So macrophages, they learn to be macrophages in the spleen. Now, where do these things come from in the first place? Well, they come out of the bone marrow. So now we've got another interconnected system. The bones, they are much more than a skeletal structure or a scaffold for us to hang muscles on. They're very metabolically active. Recent studies have shown that a chemical released from bone is a trigger mechanism for the fight or flight response. And so we just keep learning more and more about how many integrated functions the various organ systems have in order for them to work together to keep us alive. Same with the thymus here. It is very active and quite large at birth and early childhood, but it stays active throughout our life. So another place where the immune system learns and the interface between the immune function and the lymphatic system. Now it's helpful, and you may find this on the MBLEX exam, to know where these basic nodes are and the names of them. I think there's a diagram up here of those. Yeah. All right. So you're going to want to have that language embedded, and they're pretty much described based on their location. So the mammary plexus, the axillary nodes are in the axilla, the inguinal nodes are in the inguinal area. So your general body landmarks and knowledge of that terminology will help you locate a nodal cluster. So now that we have the structure in play, then we can take a look at the actual drainage function. And I've been talking around that throughout this video. So as you read through this, keep trying to understand the connection between normal function of this drainage structure, this fluid transfer system and cleaning system to the methodology about lymphatic drainage discussed in your fundamentals book. So if the lymphatic system is not functioning optimally or functioning well, then pathology develops. And because this is a filtering system, if we have interference with the flow through there, that can have some pretty significant results on health status. So edema is an increase in fluid in the tissue space for some reason. And so it also can accompany congestion, which is too much fluid in the vessels. And this could be simple edema that is logical. Again, eating a bunch of popcorn and salt while sitting still, that's going to influence the fluid regulation, and you're not going to have your normal pumping for exchange because you're sitting still too much. And that usually reverses itself. It can be hormonal, but it can get significant. Also, edema swelling is part of the normal inflammatory response. And the increased fluid dilutes some of the metabolic waste from an injury and keeps that the dead tissue from the injury. It helps move it away, washes it away. But that also can be persistent, or it can be hormonal related or whatever. So the real pathology with edema is when it becomes lymphedema, when it really is becoming toxic, the fluid is expanding, you're starting to get an increase in limb size, the tissue, the skin, superficial fascia becomes compromised. And this can be from an obstruction where the fluid cannot go through the vessels, and then as it swells like a water balloon, then it also prevents the collectors from working. So, it perpetuates on itself. Sometimes that obstruction is due to, there's a parasite that is in many of your southern countries in Africa that can get into the lymphatic vessels, and it just clogs them up. This can occur if the normal drainage pathway has been disturbed. Commonly, you'll hear about this with removing lymph nodes in the axilla related to breast cancer surgery, and then interference with the draining of the arm. So there are a lot of reasons that this can occur. And the most effective treatment for this is external pumping systems, like sleeves that you put on, and it pushes the fluid very rhythmically. Even the best approach to lymphatic drain can't do better than these external pumping devices that people will put on. And these pumping devices are used for sport recovery too, because there's one of the thoughts that causes around what causes delayed onset muscle soreness is that there's an increased fluid, interstitial fluid, that's pressing out against pain sensitive structures. Again, think of a water balloon. And so they put the athletes in these rhythmic pumping sleeves and it mostly the lower body, but also up into the torso, because the pumping in the torso is what really is causing the exchange in the lymphatic system. And they work really well. So this gives you another schematic, another drawing, another representation of the direction of flow of the lymph. And some people get very meticulous with that. I am a little less meticulous around that. I don't think that we can mechanically affect the movement that much. But what I do tell people, from the waist up and in the arms, think about moving toward the axilla and the anterior, the clavicles. And then below the waist and the lower extremity, think about moving towards the groin. And those are areas, then this, once the lymphatic fluid gets into this area, then it goes into the deeper vessels in the torso, where it's affected by movement of the viscera and breathing. So other than those ideas with the lymphatic system itself, the lymphatic system becomes a place where infection can travel. There's wondering if it isn't a place where cancer cells metastasize. And you get blood cell abnormalities. So leukemia is discussed here, but it's not exclusive to the lymphatic system, nor is it exclusive to the cardiovascular system, particularly the blood. You can get tumors that consist of bundles of lymph vessels, and these can be small or they can be quite large, and they can also be combined with an angioma, which is a collection of the blood vessels too, and they can be disfiguring. They can they can be benign and or malignant, and so you need the right kind of diagnosis on these, on what to do with it, whether it's trying to if there's a disfigurement with them, or if there is blockages there, what kind of treatment would be used. And you don't need to massage over these. Hodgkin's and non-Hodgkin's lymphoma, again, are the interface of the lymphocytes, the macrophage. It's that combination of blood and tissue fluid and the ability for that to spread cells, and oftentimes it will show as swollen lymph nodes, as will an infection in the area. There'll be swollen lymph nodes. So one of the things we screen for here when we're doing massages, any kind of a lumpy nodal area or irregularity in the tissue that would feel like a tumor or a lump. So, and then it's the referral that happens from there. Fortunately, these, if they're caught early, can be treated quite successfully. So I got ahead of myself a little bit talking about the lymphatic malformation. So these are the common types of conditions that are more specifically related to the lymphatic system. The reason why I keep stumbling over this is that the lymphatic system is a transport filtering system. And so when something interferes with that, and these are some things can interfere with that, but it also is a location where you can have changes in tissue growth. And so that it's harder to describe this than it is to describe a sprain or a strain, which is much more clear cut on what's going on with it. So generally, whether it's circulation or the lymphatic network, we can't avoid, when we give a massage, we cannot avoid at least affecting this stuff on a localized mechanical level. And because it's a fluid, it will respond to a mechanical force. And we just want to be careful that we don't make something worse. Like we might think we need to massage over a lymphatic malformation because it feels like a knot, and it's not. So we need to be real clear about what we are touching. And in all indications and contraindications in any system, we need to learn more about what not to do as opposed to what to do. We're going to cause more harm by doing something than by not doing something, unless we're not referring, if we have a suspicion that something might be going wrong pathologically. So I'm going to have the same ambiguity type level when we get into the immune system here, because these are so interwoven with all the other body systems. You can't talk about a pathology like Hodgkin's disease. You can't talk about it specifically without encompassing so many other body systems. Okay, so let's see what we can do with the immune system here. So right now when I'm filming these, we're still in the pandemic for COVID-19. So in the news, in the general discussion, there's been a lot of talk about the immune system and things like herd immunity and innate immunity and all of that. Generally, the immune system is about, it's a surveillance system that, well, first it's a barrier system so that pathogens can't get in. So our skin and in the mucus that traps it, so the pathogens don't get into us. And then it's a surveillance system that travels throughout the various tubes, including lymphatics and the cardiovascular tubes, and they can, the immune cells can squeeze out through the capillaries and float around in the interstitial spaces. They like to hunker down in the interstitium, you know, and do surveillance. And then when they find something, they quickly act, and they destroy it in a variety of different ways. And so it keeps things in check. And that also is surveillance for tissue abnormalities. And so your immune system will be on surveillance for cancer cells, which are cells that have mutated and they don't belong anymore. So if our immune system, both as a barrier and as a surveillance system and then an attack system, is functioning well, it'll keep us pretty healthy. Now, if it becomes overly aggressive, then it starts attacking the body itself, starts attacking itself. And some of the really serious illnesses related to COVID-19 were related to an overly aggressive immune response to this novel pathogen. And so you just got very aggressive inflammation, and all of the things that would typically rid the body of the pathogen, but because it was so aggressive, it actually caused damage in and of itself. And then in an autoimmune disease, for some reason, it's inflammation based. For some reason, our immune system has decided that the tissue needs to be eliminated or attacked. And the disease is named for the tissue the immune system is going after. So psoriasis, it's the skin, and multiple sclerosis, it's the myelin sheath on the nerves, and in Crohn's disease, it's the lining of the intestine, and I could go on. Rheumatoid arthritis, it's the synovial membranes. And so the generalized treatment for that is something that interferes with inflammation and the immune response that's causing that. So a variety of anti-inflammatories, and those can be divided into two classes, steroidal and non-steroidal. So cortisone, prednisone, is your steroidal, and your non-steroidal would be aspirin's non-steroidal, Motrin is a non-steroidal. And so by diminishing the capacity for the inflammatory response is what is typically targeted for autoimmune conditions. So that's what we're trying to grapple with here and understand that. So here are our various pathogens. And then this drawing here is giving you all of the structures and an overview of the various cellular functions that are involved in immunity. So this can be described as first line. That's mechanical barriers, our skin, for example, and chemical barriers, which is the, we're a little acidy, acid mantle. And they're also talking about the bionome, which that bacterial colony that lives on us that actually can be protective on the surface of the skin, but maybe once it gets into the wrong spot, then it can become destructive. And then a second line of defense is where we have this surveillance and then the different cell responses. So phagocytosis is when it actually goes and traps it and digests it. And we have specialized cells that do that. And then we have our third line of defense, which is immunity. And so this is, again, it's been a big discussion at the particular time that these videos are being produced about the idea of a vaccine. And we developed that ourselves, actually. I mean, if you are exposed to a disease and the immune system provides a good secondary line of defense on this, it will learn what that pathogen looks like or smells like chemically, and it will develop an antibody that will quickly rally an immune response. So you generally know if you're ill, because it takes a lot of energy for the immune system to go after these pathogens. And there's a generalized inflammatory response that goes with it. And so you get these overarching symptoms. And fever is a biggie, and malaise is just not feeling very good. So this figure is again trying to give you a visual on these first line barriers, which is your skin, second line, which is the inflammatory response and phagocytosis, and then your specific defense once the immune system has learned what to do. Okay, so skin, mucus, the acid in the stomach, the intestinal tract, the mucus in the upper respiratory tract. That's why we get so globbed up, is that if there's a pathogen present, mucus secretion is increased, and it traps it as well as moving it out of us. You do really want to understand the inflammatory response. Productive inflammation supports healing, and this ridding ourselves of pathogens. Chronic inflammation, non-productive inflammation can cause a lot of problems. And everything from heart conditions to susceptibility to a diminished capacity in the immune system, so that you're getting colds and bronchitis and, constantly over and over. The inflammatory response is often involved in that. It doesn't know how to dial it down. So back to the idea of balance, that too much of a good thing. Inflammation is a good thing, but it can also become a bad thing. So this is a schematic here that tries to give you a visual, again, of now the inflammatory response and everything that happens with that. And here are the cardinal signs of an inflammatory response. And if everything works well, the pathogen is eliminated, and the tissue heals or the condition resolves. Okay, so here is a table that describes the adaptive immunity. Follow that around, just follow that down and look at what it is saying to you. And then we get into this whole body-mind connection idea with the immune system and the interface with the autonomic nervous system and a variety of hormonal interactions. And oh my goodness, the studies now on the gut biome, and it just, again, now I find myself in this big thing that it becomes too complex to say, okay, this causes that. It's like this occurs, which goes and tells that sends this thing over here, that then tells that to do something else. And it becomes mind-boggling to me. We are certainly miraculously made. And of course, it can go haywire, like we talked about with persistent inflammation and autoimmune conditions or suppressed immunity as well. And stress will suppress the immune system. So how does our mood, how does our view of the world, is the cup half empty or half full? How does that affect our ability to maintain homeostasis and renew ourselves? Sleep. Quality restorative sleep is a huge issue for productive immunity. So sometimes we we don't have productive sleep, and massage has been shown to support productive sleep. And I'll say over and over and over, if a person can sleep better because of massage, then a lot of the rest of this will sort itself out. So here is your pathology, and they can be divided into too much and not enough. So an allergy, I talked about autoimmune conditions, but there's also an allergy, which is also an aggressive inflammatory response. So, you know, we live in Michigan, and we've got a lot of pollen, a lot of different pollen, and it gets into the mucous membranes and it irritates, and then our immune system kicks in, creates more mucus to try to get it to flush out, and then if the whole thing gets too irritated by the whole thing, then we end up with a much more serious response. This can become really serious if somebody has an anaphylactic reaction. Somebody who is allergic to peanuts, for example, or has an allergic, an over dry allergic reaction to maybe a medication or something. That's a medical emergency. There are also some viruses, usually it's a virus, that just drains on the immune response and tires it out. And that's what the human immunodeficient virus does. And eventually we're controlling this really well right now. And that's, yay for medicine and lifestyle and the understanding of all of this. But eventually it will cause an acquired immunodeficiency syndrome, which then allows other conditions that the immune system would normally manage to take hold, which then can result in significant health problems. Viruses are notoriously hard to control. Vaccines are used against viruses to try to teach the immune system in a really controlled way to recognize when there is a viral invasion. And sometimes it's pretty permanent. I mean, the measles is a virus, and vaccine against that it is really quite successful. Others, like the flu, sometimes it only lasts a season. And others, like the common cold, it just mutates too much. So, they're smart. They are really smart. And if they come into contact with something that threatens that survival, then it changes something so that it's not recognized and it can hide more. So here's your box that describes hypersensitivity malfunction. And that will also, then we also talk about the immune deficiency syndromes. Hepatitis is caused by a virus, and it's an inflammatory process. So that's why it's listed here under the immune system. And it usually affects the liver. So and then the liver is a very important, has many functions. And so if the liver is compromised, then other body systems, regulatory functions are going to be strained. So hepatitis are contagious, and all of our sanitation mechanisms that we have in place in our environment, and hand washing and all of that, are to control the spread of these viral pathogens. The Amblex exam likes to differentiate between the various types of hepatitis. So you will want to slow down and have a working understanding of the difference between hepatitis A, B, C, etc. This table gives you all of the different autoimmune conditions, and there's many more. So this is too much immune system, or immune system concentrating on one tissue type or one function. Very hard to control autoimmunity because it's too much of a natural process. Mostly it's controlled with anti-inflammatories. So when we think about how massage can benefit the immune system, there are things that massage does, like support sleep, helps the body regulate sympathetic, parasympathetic interface. There's even a couple of studies that shows that the compression in the mechanical loading of certain cells, as we do with massage on a very macro level, can reduce the inflammatory response. we as professionals need to be taking proper action against pathogens. And we have to realize that if our clients are stressed, they might be immune compromised, or if they're tired, or if they're already dealing with a condition that the immune system is trying to deal with. These are things that interfere with the adaptive capacity. We've talked about that before. And if the adaptive capacity is strained, the immune system functions are strained. So we don't want to, if somebody's already got a stressed immune system, then we need to be cautious that we don't use forms of massage that challenge it to respond. And those most often would be in the therapeutic change type category. Whereas massage targeted more to well-being and stress management is more supportive to the immune system. So here is your little summary, and that finishes the first chapter here. And so we have an activity here that you really need to wander yourself through. So this one is asking you to pick some sort of condition, pathological condition, and come up with a justification statement for why massage could be beneficial. And so there's an example in the back of the book. And then we have our critical thinking activity, which is also important that you give due diligence to. This gives you some help on searching. And then here are the questions to respond to. And then the author's response is on Canvas for you. You know where to find these now. Or for non-HEC students, it would be under content updates on the Evolve site. So there's a lot of language to learn here. And that's reflected in these factual recall questions. So when you go through these and you use these to study and you use these to discuss, you need to know what all of these terms mean. And then the application and concept identification, clinical reasoning and synthesis questions. Now that you know what the terms mean, this is you've got to determine the relationship of these terms and situations, and how massage in particular would interface with this, or how massage would interface with a treatment if there was a pathology involved here. And one of the best things you can do is write your own questions. So do that. Okay. This is leading us to the final chapter in our essential studies, essential science studies. And chapter 12 will discuss these 4 systems. And it'll be laid out just like the previous chapter. And so we're really learning a lot. We've really absorbed a lot of information, because the sciences at Health Enrichment Center are taught sequentially from chapter 1 through chapter 12. So as we get into this final chapter, you should start to be pretty impressed with yourself, especially if you've done your due diligence and you've been your own best teacher. Okay, let's stop our share. And this this particular chapter also, studying of these last two chapters also indicates that we're coming to the end of our year-long program. So at this point, students are sometimes going, oh goodness, you know, and I need to really start thinking about what my professional career is going to look like, and that you can start to think about that in chapter 13 in your fundamentals book, where we talk about that. And also the MBLEX exam, and how you've accumulated the knowledge and the language to be able to successfully challenge that exam and get your state license. So, okay, one more chapter to go.